How can you recognize early symptoms of reproductive cancer? Spotting early signs of reproductive cancer can be challenging because symptoms are often subtle or similar to less serious conditions. Being aware of your body and noticing persistent changes is key to early detection. For cervical cancer, early stages usually show no symptoms, which is why regular screening tests like pap smears and human papillomavirus tests are so important. When symptoms do appear, they may include unusual vaginal bleeding that happens between periods, after sex, or after menopause. You might notice a watery, bloody, or foul-smelling vaginal discharge. Pelvic pain or pain during intercourse can also be signs. Sometimes, there is pain when urinating that isn't caused by an infection, or persistent lower back pain that isn't linked to activity or injury. For uterine or endometrial cancer, early warning signs often involve abnormal uterine bleeding, such as irregular or heavy periods. Postmenopausal bleeding or spotting is also a red flag. Some women experience pelvic pain or a feeling of pressure in the pelvic area. Recognizing these signs and consulting a healthcare provider promptly can lead to earlier diagnosis and better outcomes. Ovarian cancer can be tricky because early symptoms are often vague but tend to persist. Common signs include bloating that doesn't go away, pain in the lower abdomen or pelvis, feeling full quickly or losing interest in eating, and needing to urinate more often or urgently. Changes in bowel habits like constipation or diarrhea may also occur. Because these symptoms are common and can be caused by many benign conditions, persistent or unusual symptoms should always be checked by a healthcare professional. Testicular cancer usually presents with a painless lump or swelling in one testicle. Some men notice a feeling of heaviness or discomfort in the scrotum. Dull aches or sharp pains in the lower abdomen or groin area can also be early signs. Sometimes, fluid may suddenly collect in the scrotum. Recognizing these signs early and seeking medical advice can lead to timely diagnosis. Across reproductive cancers, general symptoms like unexplained fatigue, pain lasting more than a few weeks, or changes in bathroom habits such as urination or bowel movements can also be signs of concern. External changes like unusual sores or skin changes on genital areas might also be present. Because many symptoms overlap with benign conditions, the most important thing is to pay attention to their persistence and severity. If symptoms are new, unusual, or do not improve, consulting a healthcare professional is essential. Regular screening and understanding your normal health patterns can help catch issues early. Remember, early detection saves lives, so always seek personalized advice from qualified medical providers to interpret symptoms and determine the right next steps.